Good afternoon. My name is Cristina Thiebaud, and along with my colleague Juan Daniel Alvarado, we will be presenting our abstract today in representation of Asociación de Educación Médica Hondureña. The topic of our abstract is Discussing Medical Education Methodologies During the COVID-19 Pandemic, Expert Panel in Honduras. We do not have any disclosures to make or any actual or potential conflict of interest in relation to this presentation, and the views expressed in our presentation are our own. Rationale. In Honduras, the most prevalent teaching model is still the traditional teacher-centered model. There is little research and data available that can help measure the efficacy of the models currently implemented. Through a virtual expert panel, medical education methodologies, their challenges, and benefits if implemented in Honduras were discussed. Methods. We conducted an integrative review of literature because we wanted to see if new methodologies in medical education were currently implemented in Honduras. Unfortunately, we could not find any literature on this, so we decided to implement interviews on teachers and students to find out about what was their point of view on the methodologies currently used. We did find out that the teacher-centered model was the one that was predominantly used. Because of this, we decided to do an expert panel to discuss new methodologies. We used the Proceed and Proceed model by Green and Kruger to plan and execute the expert panel. We invited the 3 deans of the 3 universities that offer the degree of medicine and surgery in Honduras, and we also invited the president of the Federation of Professional University Colleges of Honduras. Once they accepted, we sent them supporting material which included a summary of the methodologies and also questions that they would be asked during the panel. The topics that we discussed were problem-based learning, reflective practice, formative assessment, and self-regulated learning. The expert panel was part of the first conference on medical education and clinical research teaching in Honduras. As an association, we did do a partnership with a Honduran university in order to do this conference. My colleague, Juan Daniel Alvarado, will talk to you about the panel and the conclusions.
Thank you very much, Cristina. My name is Juan Alvarado, and I'm going to talk about the evaluation and achievements of the expert panel. To our knowledge, this is the first expert panel that discusses teaching methodologies amongst deans of the 3 universities in Honduras. The COVID-19 pandemic has affected the whole world in many ways. In spite of that, we managed to do this event in Honduras with a virtual platform, with an audience of around 409 people from Latin America, North America, United Kingdom, and Italy. Among the attendees, there were doctors, biologists, pharmacists, nurses, dentists, psychologists, chemists, professors, and students. As part of one of the objectives of this event, we wanted to publish an article where we shared how we planned and executed the expert panel as well as sharing the conclusion of the panelists. We wanted to do this with the purpose of creating national data about medical education. The article was published in a Honduran journal of science and technology called Innovare in August 2021. As part of implementing the feedback methodologies, we asked participants to fill a survey after the conference of which the panel was part of. 5.8% of the participants, which corresponds to 24 out of 409 attendees, fill out the survey, reflecting that we are not used to giving feedback. Among the most frequent responses were the interactive method, how the types of learning were explained, the humanistic view on higher education, between others. To conclude, problem-based learning is a method that teaches the student how to approach a problem and solve it. However, in Honduras, it is limited by the economic factors training, physical space, and acceptance by teachers and students. Reflective practice helps to identify the causes, effects, and solutions to everyday problems, but in Honduras, its implementation is limited by the students' own culture of being afraid of not being taken into account or criticized by the teachers. Self-directed learning is highly influenced by motivation, academic demand, and in order for students to implement it correctly, they need to be trained and provided with adequate tools in order for them to meet their self-imposed goals. Feedback is necessary in medical education, and part of its implementation consists of efforts to eliminate the fear of students to receive criticism, of being made fun by teachers, which unfortunately is common in Honduras. A national discussion is necessary to detect gaps and necessities of both students and professors in order to fulfill their necessities. We plan on doing a second conference as an association this year, where we will be discussing medical education topics, and we would like to have more international collaborations with other medical educational entities that can enrich our initiatives. We would like to thank the team that worked with us in planning and executing the event, as well as the Universidad Autónoma de Honduras for being the host of this first conference.